The EQUIP project is a joint WHO-UNICEF project being funded by USAID. It's been going for a number of years now, but we launched it formally in terms of publicly in March 2022, at the end of March 2022. The title is Ensuring Quality and Psychological Support. It's now got a bit broader than that. So I think you're all looking at psychological interventions, but we're also seeing how some of the resources and tools I'm going to present here could be useful beyond just the delivery of psychological interventions. In fact, for anyone who might be training someone in a helping role, to provide some sort of basic helping skills, foundational helping skills as well. And that's within the health, mental health sectors, but beyond in social care sectors, education sectors, and even further. So we think it has quite wide applicability, and I'll talk about that later on. So just to really quickly go into some of the background around EQUIP and where this has come from. And I think these are things that everyone probably on this call is going to know about. But as we know, that there's high levels of unmet mental health needs. And as you're all involved in, I believe, we now have a number of interventions that we know can be delivered by non-specialists, so people without a mental health background specifically, and there's an evidence base to show that they can be delivered very effectively. Not to say that these interventions can't also be delivered by those with a mental health background, but this is the idea that in terms of being able to scale mental health care and meet this gap that exists globally. What we see as an ongoing issue is we have great evidence base, but how do we know in the real world how these interventions are being delivered, and how do we know that they're being delivered in ways that replicate some of the effectiveness that we've seen in the trials, and also how do we know that they're being delivered in a way that does no harm? So when we've looked at this, what we're seeing globally is that there is a lack of a benchmark, particularly when we think about non-specialists in mental health for what they should what capabilities they have, what skills they should be able to have, what knowledge they should be able to have to effectively deliver these interventions. And also what we're increasingly seeing is shorter and shorter trainings for these people. So EQUIP comes in here trying to say, okay, how do we set some sort of benchmark? How do we really focus on the quality of some of the delivery of some of these interventions? So EQUIP really is focused on the trainers, the supervisors, the program managers that are supporting others to deliver psychological or helping interventions. And here, as I've said, we're thinking not only within the mental health sector, but beyond, and also not only in kind of NGOs or even ministries of health, but also in academic institutions as well. So how can we support a more comprehensive teaching of psychological interventions, essentially? And where EQUIP has landed is on this idea of competency-based education. So EQUIP really is a range of competency assessment tools and resources to support competency-based education that are freely available for everyone to use, that lead to enhanced training and supervision practices. And all of this is freely available on an online platform. And I'll go into kind of what we mean in EQUIP by competency, and I'll go into a bit more detail about the platform as well, but just how we think this helps in terms of this approach of being able to assess competencies is that through the use of the tools in EQUIP, you can start to really, in quite a focused way, look at where your trainees are already strong. So what are they doing well already? What is it that they're not doing so well? And what is it that we really need to address to ensure that they're not causing any harm? And how can we use the information from these assessments to really provide very structured, targeted feedback that supports a trainee's development? And that is in training itself, but also on an ongoing basis through supervision. So the tools really offer structure to help you really focus in on that feedback process. And I would say that's at the core of EQUIP, really. It's when I show you the tools, you'll look at different levels and things like this, but really it's about how do you use the results of assessments to provide very, very specific feedback that we know leads to improve learning, really, and improve delivery of skills amongst trainees. And then also it's useful for trainers themselves in terms of thinking about the content of their training and supervision. So based on the strengths that we've identified in our trainees, based on areas where we think they're struggling more, how do we adapt our training so as we're more targeted in what we're doing? In terms of the development, so Equip's been going since, I think, early 2018. And it's undergone, the tools have undergone quite an iterative development process in collaboration with a number of different NGOs that are operating globally across a number of different contexts. So Equip hasn't been built by myself or people in WHO. It's been built as a collaboration across a number of different providers. And when looking at the tools, we think there's kind of cross-cultural validity. Some adaptation needs to be done, but they have been trialed and been found to be effective in all of these different contexts. And I think crucially as well, the tools have been helpful in the delivery of a number of different interventions. So here we're looking at WHO interventions such as PM+, and EASE, which is a kind of adolescent intervention that's soon to come out that's based on PM+, really, with some adaptations, but also non-WHO interventions developed by some other institutions, such as the Common Elements Therapeutic Approach developed by Johns Hopkins, CETA, trauma-focused CBT, et cetera, et cetera. So we think the tools that we already have within the Equip suite of resources have applicability across a number of different interventions. And so in developing these tools, we've then gone and trialed these tools with all these different organizations in these different settings. And what we've found is quite moderate to large effect sizes in terms of the improvement that using an Equip-based approach to training, so that would be assessing competency in your trainees, providing feedback to them based on the results of those trainings, as opposed to a standardized training, which might be pre-post knowledge assessment or something like that. What we're seeing is real improvement in helpful behaviors. But I think very crucially, and quite uniquely, I think for Equip, we're seeing a reduction in potentially harmful behaviors as well. And again, reasonable effect sizes with that. So I think that's a really important part. And we do have some kind of emerging research to show that good supervisors, I guess, are as good as Equip in terms of identifying what trainees are doing well. But what good supervisors are less good at doing is really noticing some of the potentially harmful behaviors. And I'm not quite sure what that reason is, and we could theorize about that reason, but that seems to be what Equip really does. It really helps to identify what some of those potentially harmful behaviors could be, so as we can be more confident that when someone goes to deliver in the real world, that they're doing it in a safe way, really. And this is a trial using an Equip tool, so ENACT, which is an Equip tool, which I'll take you through, but that looks at what we call foundational helping skills. So these are your basic helping skills like verbal, non-verbal, empathy, et cetera, et cetera. So assessing this and using the tool to provide feedback on people being trained in MH-GAP, which is another WHO intervention that's really about scaling up doctors' capacities to be able to provide very basic psychiatric care in primary healthcare facilities. So here we're looking at how the use of ENACT and using ENACT as a tool can support those being trained in MH-GAP to actually have improved diagnostic accuracy, both in follow-up to training and also in their work with actual patients as well. So just to bring us back a bit to what we mean by competency in Equip. So when we're thinking about competencies, we're thinking about the collection of someone's knowledge, someone's attitudes, someone's skills, and how those are displayed in behaviors when someone's performing a task. So really in Equip, what we're focused on is what can we observe when someone's actually practicing or doing the intervention? What can we see, and what are the behaviors that we see that tells us that someone has really embedded the knowledge, embedded the skills, and is able to practice it effectively? So in Equip, we're really focused on this idea of role plays, and very structured, brief role plays, where the person playing a client would have prompts to help them elicit the behaviors that we want to assess from the trainee who would be playing the provider. So we think it's really important to create that kind of controlled environment. So we run a role play and then we do the competency assessment alongside that role play. We think it's important to have that controlled environment so as we can make sure that we are testing what we want to test, we're assessing what we want to assess, which isn't to say that the tools couldn't be used in real world observations. It's just that we think that needs to be paired with role play assessments as well. And what the tool looks like. So here I'm looking at what we would call, I guess, our kind of what we're calling our foundational helping skills tools. So we think core to delivery of interventions effectively are these kind of basic helping skills, these foundational helping skills, where we're looking at things like verbal, non-verbal communication, empathy, confidentiality, assessing and managing self-harm and safety, these things. So these are, I guess, a core to equip and equip's suite of tools. And here you can see what an example of a paper version of the tool looks like. So in ENACT, we have 15 different competencies, and this is one competency that you're looking here. You're looking at empathy. And within that, you'll see a number of different, what we call behavioral attributes within each of those columns. So these are, you're running a role play with someone, and you as an assessor are looking out for these specific behaviors. And if you see these behaviors, you tick them off. And then at the end of that assessment, you can then see, based on a very basic scoring algorithm we have, what level someone is at. And then you would do this for each of the different competencies. And in ENACT, we'd say you can run a role play in 10 minutes. And with a bit of practice, that 10-minute role play, you can assess all 15 competencies. Then the idea is once all that information is gathered, you can then provide feedback to your trainee. So the levels then range from, are we witnessing any kind of potentially unhelpful, harmful behavior, through to, are we seeing a basic level of competency that we think is adequate, or are we seeing some more advanced helping skills? So just to go into ENACT in a bit more detail, so there's 15, as I said, 15 competencies within ENACT. ENACT is really based on this idea of common factors. So the common factors that we might see that across all interventions that we know are necessary for having some sort of effectiveness within that intervention. And we've grouped these different competencies according to different elements of that interaction. So the different competencies that are necessary to engage with someone, to do some sort of basic assessment with someone, and then to provide some sort of basic support. And the use of these tools can really be done flexibly. So we've organized it in this way. So say someone's doing a very basic intervention, for example, Self-Help Plus. We've had people use parts of ENACT for Self-Help Plus, but they've taken mainly the items from the bottom engage row and not assessed trainees on any of the other items, because they think that's almost too advanced. It goes further than the Self-Help Plus intervention requires. But equally, if you're thinking about PM Plus, which is a bit more of an involved intervention, and you might want to think about competencies across the engage, assess, and support levels. And then within the equip suite of resources, we have a number of other competency assessment tools. So we have other foundational helping competency tools. So we have an equivalent of ACT for children called WeAct, an equivalent of an ACT for groups called Group ACT. Then we have specific tools that we've packaged up for specific interventions. So we've got one for PM Plus, for thinking healthy. We're developing something for MH Gap. And then we have specific tools looking at specific techniques within an intervention. So kind of cognitive techniques, behavioral activation techniques, stress management techniques, interpersonal techniques, that sort of thing. The idea being then that you would assess someone on some foundational helping skills, whether it's all 15 or a selection of those 15. And then you would, on top of that, assess someone on their more treatment or intervention specific competencies as well. So you can pair different tools together to provide a more comprehensive assessment of someone's skills. So not that you would assess all of these things, it would probably take forever, but that's the idea, that you compare everything together. And all of this is available on a platform, which I think is easier because it's slightly changed in its format recently. But I think it's probably easier for me to actually just take you through this. So can you see that as well? Yeah?
Yeah, yes.
So the platform has a homepage where we have a bit of information on what Equip is, some videos about Equip. We're also about to add some instructional videos on how to use the platform. It's available at the moment in a few different languages. More languages are on the way. Essentially, everything on this platform is released on Creative Commons. So if anyone's interested in translating anything, we'll happily hand the materials over. You would then translate it, and then if you were interested in putting that on the platform, we'd support you to be able to put it on the platform as well. So this is the way we're trying to get it in as many languages as possible. What you'll find in the different languages is that not everything in the platform will be translated at the moment, but some of it will be. So on the platform, we've got a how to use section, which is basically our e-learning section, where there's different courses about how to use the platform, what competency-based education is, a range of different courses. We've then got a number of resources on the platform. So we've got a guide on how to use the platform again. We have all the competency tools in PDFs in different languages that are available at the moment. We have scripts. So when you're running the role plays, we have scripts that can be used and adapted to aid you in running the role plays. We have some role play videos that can be used in training, actually, or can be used as a kind of guide of how you might run a role play. And then we have a number of other resources. We have publications that are behind the Equip project, a bit of a guide on how you might rate and score, so a number of different things. And we're always adding to this resource. And then what I showed you was a paper version of the tool, but that tool is also available as an online version of the tool. So what you do on this platform is you basically create a training, and you select all the different tools you want to assess people on in this training, and you have a different assessment time point. So it might be at the beginning, at the end of training, ongoing in supervision, or whatever it might be. And then we have our trainees to the left. So I then go to assess. Oops, not that one, because it's already been assessed. But I might go here, I go to assess. And then we have, as I showed you before, that all the different competencies down the left. So before we looked at empathy, and then we have all the different levels and the different behaviors within it. So again, you would watch a role play and you go through and you click on the behaviors that you think you witnessed during that role play. And at the end of that assessment, you would just submit the assessment. And this can be done on a mobile phone, this can be done on a tablet, and it can also be done offline as well. The advantage of using the online tool is that you then get automatically a graphical representation of the scores and how your trainees are doing over time. So you get a summary of the group here, and then we can look at the different assessment time points, and it will flag what areas are people potentially struggling with. So you as a trainer can look at this and go, okay, I need to revisit non-verbal communication, for example, because lots of people seem to be struggling with that. Or I know that I don't need to spend so much time on confidentiality, or whatever it might be. So you can look at this assessment time points here, and you can download all of these results as a CSV file. So then you can use and manipulate all of that data whatever way you want. You can also, in the feedback that you're providing to individuals, you can go in a detailed way to the individual's performance and look at how they've done on a general level across all the different assessment time points. But then you can go into an assessment point and really look at how they've scored, and even go to the point of, okay, on this tool, what did you tick when you assessed them? So as when you're giving feedback, you can now be really structured, really focused in terms of giving that feedback to someone. Yeah, let me go back to my slides. Not very well. So I guess what I want to quickly say is that the way you use Equip really depends on how you want to use it. So I would say at the moment, and you might have got this sense listening to me, Equip can be really complicated and can be kind of difficult to initially get your head around. But really it is just doing assessments, doing competency assessments of the people you're training and supervising. So you could do that really, really quickly. You could just go on the platform, just get a tool and do an assessment with a trainee, in a supervision session. And you could do that together, and it could just be helpful as a learning tool. You could do it more as a part of an ongoing training process and really integrate it into that training, doing it for a group of trainees, really using the platform, looking at progress over time. But you could also use it in a much more standardized way. So I guess this might be more useful for a university or someone to make sure that everyone is getting a kind of fair assessment, all your trainees are getting a fair assessment. We do have resources to help you train people who might act in these role plays, or people who might rate the assessments, if you want to use independent raters, independent actors. So how you might train them, how you can make sure that your evaluations are a bit more standardized, and then an organization could use that towards accreditation. So it can really be used in a very flexible way. And as I've also said, you can kind of pick and choose what elements of different tools you want to use. Not everything will be relevant to you and your intervention. Unfortunately, the platform doesn't allow you to create your own tool and pick and choose from the tools. You need to kind of do that yourself, and it's a little bit clunky, but there it is there, and we're not saying you have to stick to each measure. Very quickly, I think what I can say is that we have a number now of different organizations that have started to roll out Equip and started to use it in their practice. So this ranges from very local organizations training, peer supporters, really. So really using the Equip tools in that training, it helping those peers to really see what some of these skills are, particularly what some of these foundational helping skills are, and to get a bit more concrete about what they are, and to feel a bit more confident about what they're delivering, and confident in how they're supporting their peers, really. So it's been really effective in that sort of way, and it's been adopted by smaller organizations in that way. We've also seen it on a kind of national level. So we've worked a lot with the WHO country office in Zimbabwe, who've teamed up with the Ministry of Health there to do the big rollout of MHGAP trainings. And we've done lots of TOT trainings where we've introduced trainers to Equip, and started to explore with them how they could use it in their trainings and ongoing supervision of MHGAP. The issue that they've previously faced with MHGAP is that they train people, then they don't see much implementation and delivery, and using Equip as a way of really checking in and really structuring ongoing support and trainings. And then also in supervision. So what we've seen in some organizations is, yes, using the Equip resources in training is helpful, and it improves competencies, but actually it's about revisiting those competencies, revisiting the role plays in supervision, I think this organization do it on a kind of monthly or fortnightly basis. They'll take a competency that they think is really important, they'll run some role plays, they'll provide feedback, in a group supervision setting to people. And through that process, that ongoing process of revisiting some of these core competencies, have really seen an improvement in competency over time. In terms of where we're going, Equip has a help desk being run by UNICEF, but supported by the whole team, where anyone can contact Equip and get very specific support and training on how to use Equip. So we do acknowledge that there are some complexities in it that we're still trying to iron out, but we are there to support you if you're interested. So I hope my contact details will be shared after this webinar, but equally on the platform, you'll see that there's a link to contact the help desk there. So that will be provided on an ongoing basis. I'm working at the moment very much with how we can integrate Equip in forthcoming publications from WHO. So we're about to release a lot of the training manuals for Self-Help Plus, for PM Plus, for EASE, and we're looking at integrating Equip in those training manuals as well. We're also creating a training manual for foundational helping skills. So this is almost the partner resource for the ENACT tool I showed you. So the ENACT tool is assessing the foundational helping skills, but we have a manual for teaching those that's integrated with EQUIP. So it's how do you use these competencies assessments in a training, which we hope to release later this year. And then really we're looking at how do we further disseminate this. We're working with a lot of global associations to try and get them to promote EQUIP. So as we can see, a number of different organizations using it. We're working with universities across a number of different contexts to see how they can apply this to their courses. And we're looking to develop more of an expert user group over time. So as EQUIP, I guess, can develop through its user resource, and that group can go on to train and support others to deliver to use the EQUIP resources. So I think I'll end it there, if that's okay.
Okay, thank you so much. Thank you, James. I think the first question we've got in the chat was like, could you please share this platform? How can we use it? Yeah, and we already have links both for English version in the chat, and
Okay.
Inna Kovalenko actually as well shared Ukrainian version, which is in progress. Of the EQUIP, and I was surprised you mentioned that there is like open to people who wants to translate and to support filling in the gaps with the languages.
Yeah, absolutely. It's free to use, it's free to sign up, and yeah, it's very much an open resource if people want to take it. So if people want to take the tools and adapt them and use them for themselves, okay, not necessarily on the platform, they're more than welcome to as well.
Yeah. So I will now open the floor to our participants and to our partners and to our colleagues to share your experience of using this tool, to ask questions. Or maybe you can share your ideas how you potentially might use this tool as well. So please don't be shy. You can put your question in the chat, but you can as well just unmute yourself and speak either in Ukrainian or in English. We will hear the interpretation. It would be nice to hear your first reflections about this. Or maybe you can share your experience of using this tool. Or any challenges you experienced during. Yeah, maybe while our audience is formulating their questions, because we have quite a lot of space for the questions. I see Anna, you raising your hand, so please go on, Anna. And maybe you can briefly introduce yourself as well.
Good evening, good afternoon, good day. It's nice to see you, Irina. It's nice to see you, James. I'm Anna Lehkova. I'm HPSS coordinator for Medicos del Mundo. And actually, maybe I will briefly share our experience, because MDM piloting, I would say, because it's also something new for us, as James presented. We are piloting ENACT 2 because, again, we understood we need to start with something very simple, more or less. We are piloting it for doing what matters in times of stress and also for PM+. It's very interesting tool. We still, unfortunately, didn't fill in all the data into EQUIP form, and actually my colleagues were writing to me, are you going to say that we unfortunately broken the platform when we started to enter data? Unfortunately, we really failed, or the platform failed, and we couldn't complete. And after, I think, a couple of days, I think the problem was fixed, and it's still in our to-do list to include the data, but our great team calculated it separately, which was quite challenging because we really want to see the results. how it's working. And for us, we did it within the training role plays, and also as a part of curriculum for supervisions. So actually we wanted to measure it 3 times. So at the very beginning, intermediate, and at the end of the program implementation. So we finished for doing what matters in times of stress. So we're gonna enter the data, and unfortunately now we don't have these beautiful graphs as you did. So we really cannot wait to see these graphs, and because we know there is an improvement, but we cannot see it, this picture, and it would be really great to see it and to show the trainees the results achieved. So thank you so much. I'm very happy to hear that it would be translated into Ukrainian, the platform, and it would be, I would say, much easier, user-friendly, because for us it was really a disaster, because me personally, I have all the information in English. Some of our colleagues were having the platform only in French, and one of colleagues has everything in Nepali language, which were even more challenging. Yeah. So quite.
Thanks. I mean, yeah, we have had, it's relatively new in terms of its release as a digital platform. So we have had some glitches, and we are constantly learning from our users about the use of it. I mean, I think there are benefits to using the platform in terms of it should be able to generate data for you much more easily that can then be helpful in terms of tracking progress, but also reporting to others. But yeah, there is a learning curve with it, I think. We think we've ironed out many of the bugs now, so we think it's a lot more reliable, certainly has been over the past 6 months or so. But we also recognise there are ongoing challenges with translation. Can I ask then, but I guess what I want to say with the platform is there's benefits, but you don't have to use the platform. You know, that this can be used as a paper version, right? You can just take.
Yes. Yeah, this is what we did finally.
Did you gain anything from it? Did you get any benefits from it that you could notice, quite apart from seeing progress amongst your trainees, though, for you as trainers, did you get anything from it?
Now what we see, also we need, of course, it's challenging at the very beginning for the team, because they are too focused on the questionnaire on the list they have, I would say. But then it's much easier. This is what I heard, the feedback received. It's much easier, and it's really helpful, because this is especially helpful when providing the feedback. It's based really on evidence-based. Now you really could communicate clearly the feedback, and not just, I would say, have general information, but you could go through all the skills and to name all of them. But from my point of view, from our point of view, was, I would say, the main thing that there was no unhelpful behavior, so no harm. And this is, I would say, is the main thing. So it was no harm at the very beginning and till the very end. Okay. But the level of empathy, and this is increased immensely.
Thank you. Thank you, Anna, for sharing your experience. I wonder whether there are other researchers or partners who implement this and have experience. Oleg, будь ласка, please.
Вітаю всіх, вітаю, James.
Hi everyone. Hi, James. I work as a WHO consultant, and we conduct the TOTs. And when we do the TOTs, we introduce all the participants to this tool. And I really like that there are, I would say, different options of this tool you can apply differently. It might sound strange, but potentially it really helps to have this larger version when you have the possibilities to measure things, and you can track things, and you can measure the base level, the intermediate or mid-course level, and the later levels. And the most important thing is that we see in ongoing supervisions, every specific skill can be broken down even further into these more specific subgroups, I would say, or even you can say that the effective communication is either there or not there, and then it can take a long discussion whether it is there, whether or not. But when you divide the effective communication ENACT into 15 parameters, and there is a scale for every parameter, when we can not just say that this is a potentially harmful skill and tick the box, and that would be it. Here we can actually be very specific in drawing the attention. Even if we don't use this for the supervisees, it can be useful for the trainers as well, because they will know like what a motivation interview is, what does it consist of, or the behavioral activation, or other elements of group work or working with the children. It's really great when this huge work is done in the background, and then it helps us know the structure of every skill, and we can actually show where there is some potentially harmful behavior, where there is some basic competence, and where it's really, really great. Thank you.
Yes, thank you so much, Oleg, for sharing. And we personally, we never met personally, but I have heard that you roll out MHGAP program in Ukraine, and you have delivered a tremendous number of trainings so far. Am I right?
Yeah, now we are proud that for over a year we have the what's called the medical guarantees package created, which is a flagship service by the Ministry of Health and National Health Service, and over 20,000 health providers at primary level, so family doctors and nurses, they have been trained at the online training course focused at MHGAP, and about 4,000 people underwent the full training with our partners. Yes, it's correct.
Thank you so much for these numbers, because I think this is really important when we think about the scalability potential of the interventions that we are using. And for example, in URICE we have 3 countries, and in each country we have trained at least 15 trainers, meaning that each pair of trainers will deliver training to another, let's say 8 to 10 helpers. This multiply the number of helpers from thousands to hundreds and thousands, and the way how we can measure the helping skills and the progress is basically by using those platforms and those standardized tools. Otherwise it's difficult to imagine. And I have more kind of practical questions, but I wonder whether there are other comments so far or questions from the audience. Okay, so maybe while you're
A couple of comments in the chat, which I
I can Oksana Kaduk, can you please read your question from the chat in Ukrainian, so we will then hear interpretation if possible. If not, let us know, we will ask somebody else to read this. Oksana.
Добрий вечір, так.
Good evening. Yeah. So I wrote that it's great that each of the competencies consists of several markers, and every level can be tracked not just subjectively by the mere scale of competence, but you can show that a specific marker, it would be the improvement area or already a very strong area. So it's a great structure for the feedback by the supervisor, or it helps one also focus the attention when we observe the work in the training or in the role play. That was my comment. Thank you.
Thank you. Thank you, Oksana.
Just a comment on the
Не
level.
може не можу не сказати.
Yeah, I also would like to comment. This was also kind of from the MDM team, because Oksana didn't say her team.
It's also the comment from MDM staff, the trainer, the supervisor who was doing, who was
Thank
using the questionnaire.
Yeah. James, you wanted to comment on
Yeah,
that,
I
right?
just wanted to comment on the levels. I think particularly when we're training people without a mental health background, there can be, I think the feedback process is very difficult, right? There can be quite a lot of nerves about receiving feedback, quite a lot of nerves about being assessed, and then that can make it quite challenging. And I think that there's this potential problem with levels is that we therefore, no one wants to get a level 1, everyone wants to get a level 4, and we start to see it in that sort of way. And I think what we're trying to promote with Equip is, I mean, I'm a trained clinical psychologist, and I think occasionally I would think regularly I probably wouldn't score highly on all elements of ENACT, for example. You know, it's very hard to perform all these things all the time, but it's more about learning. So it's about flagging and receiving feedback so someone can improve and providing that very structured feedback. So I think it's great to hear that people are finding those levels and the structure really, really helpful. I think what I'd like to encourage is that we're not creating some sort of bad feeling around getting a level 1. It's more about part of the learning process that all of us need to go through and that we're constantly on. And that's what the assessments are about. It helps us to learn and it helps us to develop, no matter what we're scoring. Yeah, does that make sense?
Yes, definitely. Thank you so much for drawing this attention. I remember very clearly this anxiety about the evaluation of the skills, and especially people who are very new to this kind of role. They were hesitant, and I think we receive, this is kind of a way how we can objectivize, right? To have more objective measurements. I would like to, because I was specifically interested in 2 things. So you mentioned, James, that like 10 minutes is enough to kind of evaluate most or almost all ENACT items within the role play. But like technically, so I am a trainer, I have my helpers, I introduce them the strategy, and we are going to role play. Then we have like somebody playing a client, somebody playing a PM plus helper, let's say, and I am a trainer and I'm sitting with the scale or laptop, and while they're doing role play, I tick those things. Or it's like better to have kind of 2 trainers. One of them would follow up the process and concentrate maybe what is happening, and another co-trainer or like somebody who's helping would give score the role play. What would be your recommendation?
There's different approaches, and I guess it all depends on what resources you have. So in my experience of training, we rarely have lots of people to train others with, and we have quite a short amount of time. So I mean, the idea would be these tools are designed so you as a trainer could role play, could act as the client in the role play and rate at the same time. So it might be that you run this 10-minute role play, which is quite structured. You maybe don't rate during the role play. You then reflect, or you make notes during the role play or something like this. You reflect, you take 5 minutes to reflect back, you score, and then you provide feedback to someone. So we'd say, therefore, the process might take, I don't know, 20, 25 minutes or something like that to do a bit more of a structured full assessment of someone, and that's without resources. The other, if you've got loads of resources, is the other side of this is to have an independent actor. So, you know, you might use, I don't know, there might be an acting school that have lots of amateur actors or something like that you could bring in and train to be actors. You might have independent raters that you train, but that will require extra training, extra time, extra people. If there's co-trainers, I think then you can either support one another. So one could be a rater, one could be an actor, or if you've got limited time, you can then split and you can run simultaneous role plays at the same time in different rooms. I think it all depends. The other way it's been used is, what we're recommending generally is that you do what we call, so pre-training role plays we think are nice to do, but aren't essential. Post-training, we think are really important. So if you do an individual role play with someone and provide feedback post-training, that's probably the most important thing. Really useful to do as well is almost to use the tools throughout training. So in your trainings already, you've probably got role plays. In the PM Plus training, you run role plays on all the different skills. You could use, as a trainer, you could just have an ENACT tool with you. As you run a role play, you send off your group to do role plays in groups of 3 or 2 or whatever. You kind of walk around, you sit in on 1 or 2 groups, and you just observe. And then maybe afterwards, you just take a few notes on the ENACT tool. And that helps you to almost get a temperature check. How's the group doing? What are they struggling with? What are they doing well? And also then helps you to give feedback to the whole group. You know, just structures your thinking a little bit when you've got a lot going on. So we generally tend to encourage that more informal use of the tool throughout the training, and then running 1 or 2 role plays at the end of a training to focus on the skills you think are most important for your trainees moving forward. And then probably great if you can do it on an ongoing basis in supervision as well. Does that answer the question?
Yeah. Thank you so much. Yeah. I see that Anastasia Zikas raised her hand. Anastasia, can you please unmute yourself and answer your question?
Добрий день, в мене є коментар.
Hi, I do have a comment. Deputy MHPSS coordinator in MDM Spain. So with regards to the application of the tool during the training, in our experience, it's really useful when applied during the training. Let me explain why. Usually, when we were training people in MHGAP, or when we're preparing the consultants in PM Plus, we usually have 2 or 3 trainers at the training. And then, for example, later, the consultants on PM Plus are also followed up by sometimes 4 or 5 or even 6 supervisors. So in order to ensure continuity between the training and the supervision sessions, if we use this tool during the training, then we can pass the information to the supervisors, so that later one of those 6 supervisors who works with this trainee would know what to focus on during the supervision session. Or, for example, they would know what are the strengths, and then what can be used as a foundation for further development. And with regards to the time to apply, in both PM Plus and MHGAP, we had a lot of role plays, really, and the trainers during role plays can do observations of the participants who act as a family doctor, for example, or we can observe the consultant who is running a PM Plus for a client. So it doesn't take long. The only thing is that sometimes in the questionnaire, we don't have the possibility to apply all the competencies available. So we can apply some, but and it's possible, the procedure allows for that. So we still apply the same algorithm, but we can focus on what we need and track what we need. And it's very interesting. Actually, it's not only for the trainer, but for the trainees. They can track their professional growth. It might be very interesting, especially if they do not have the background, the clinical background. When a few months after the training, when they were certified, when they have some experience, they have taken the supervision sessions, they've taken everything, and they can see what actually is the outcome for them in terms of the skills. Thank you.
Thank you, Anastasia.
Great to hear. Thank you. I just have one comment as well, and I think this goes back to Oleg as well, just about different ways you might be able to use the tools, whether or not you're sharing this with trainees or not, or you are. Another use that I didn't introduce in my presentation, but we now have some evidence on, is using the tools actually for selection of candidates for people who are going to deliver services. So we have some evidence that I think probably needs to be replicated, but it has been published, and hopefully it's in the publications list, that actually your non-verbal skills pre any training are really the most predictive thing of developing competencies moving forward. So actually in selection of people, there is potential use of the Equip tool as well. You could run a role play with someone, get a general sense of some of their competencies in these areas, and that could support that selection process.
So being a trainer and running some interviews, whether to include or not to include helpers into the training, and having limited amount of time, you would recommend to pay attention to non-verbal skills, as it might predict the progress of the training. Wow.
Yeah.
That's really interesting.
I think it needs to be replicated as a finding, but yeah, that's an initial finding. Yeah.
Okay, I will read some question from the chat on behalf of our participant, but before that, I will mention that I just put to the chat webpage of our project, our social media and YouTube channel, and recordings will be available and distributed through our social media. And as well, after this event, we will send you invite to our mailing list, so then you can stay tuned to our further webinars, and I will give an announcement about the next webinar and our activities. And going back to I think this is an important question, because so far we have heard participants who have already experience with the platform, but the Ukrainian, the question in Ukrainian sounds like, who receives the access to those results and evaluation, and in which form? I think, yeah, this is important to give a bit more details and like how who is registered on the platform, who receives the results, and in which form.
So anyone can register on the platform, and if you register and you create what you call a team, and then in that team you can determine who will get to see the different results of the assessments that you're running. And of course, with the platform, the only sensitive data we have is the people who are registering, their email data. So we don't have any data on your trainees, and you get to determine what you call your trainees. So you can give everyone a code, and you can anonymize everyone if you want. In terms of, so then all the data doesn't actually hold any identifying or any sensitive information within it. And it's your data essentially. The only thing is, this is held on servers in Europe according to rules around GDPR. The Equip team get to see, I guess, a collation of all the results that we're getting on the platform. But as I say, there are no names on that unless people decide to put names on that themselves. Does that answer the question? Is that what you're
Maybe I can add based on my experience. So for example, I am a trainer in PM Plus, and I will have a training for the group of helpers. So I am registered at the platform, and I create myself as a trainer or supervisor profile of my helpers, giving them names, false or true names, and then I will report. I will, for each trainee, I would have a kind of profile, and I will submit their the scores for ENACT, and meaning that I will see my trainees, I will see the progress between the difference between them, the progress within time, and I would have access to this. So my helpers, basically, they don't necessarily have access to this data, but of course you can share this.
The other thing to say is that you can add people to your team, so you can give people different levels of access of what they can see, whether they can only see the people that they're rating or whether they can see everyone. Yeah. Generally, the data is just for the people that would be training. It's not for the trainees themselves, unless you choose to show that to them in a one-to-one meeting.
Yeah, so for example, if I'm coordinator of the project and we have a lot of, and we have like a number of supervisors, so I can give them access and each of them will create profiles. So yeah, it's kind of a pyramid. We can move forward to the question of Raula. And Raula, Muhammad Baraka, whether you want to actually ask a question and unmute yourself, it would be nice to see you or to hear you.
Hello for all of you.
Hi.
Hi, hello. Excuse me, I am working as a general practitioner doctor, not psychology, not psychiatrist, but I need to help people. And I saw a lot of people with depression and trauma, and I need some training courses if available, please.
And in which country you are, and which community you
I
represent?
am from Palestine, and I am working in Kuwait.
Okay. And in terms of the EQUIP program, the training exists there on the platform itself. There is training in how to use EQUIP and how to use that as a trainer to train others. There are also, we created a few courses during COVID-19. We used the platform as a place to support training of people to deliver services remotely. So there are a few courses on there about how to work remotely with someone, how to manage someone who might be expressing thoughts about suicide. But there's nothing more than that. In terms of other courses from WHO, we don't run courses ourselves, generally speaking, on training others. We provide materials that might support people. But it may well be useful to take a look at our psychological interventions website, which I can pop in the chat. And on there are some more basic interventions, kind of self-help intervention that someone can take themselves through and can help with things like stress management. So,
okay, thanks a lot. Thanks, Alex. Okay.
Yeah.
Shukran.
Yeah. We have one more question in the chat. I have as well a provoking question to you, and maybe if our audience has any additional comments, or and I encourage people who has no experience with the platform, probably have heard about ENACT and EQUIP today for the first time or for the second, feel free as well to put your question in the chat, to unmute yourself, to let us know what do you want to know. So we have, thank you, James, for putting this. We have one more question from Katerina. Does self-evaluation is acceptable? For example, if I'm a peer and I want to assess my basic health skill, can I do that?
Yeah, you can. And we have known, I mean, in Zimbabwe, for example, I think they use it that way quite a lot. They've actually found it useful for people. I think people often get trained in some of these basic helping skills and don't fully understand what they are. And they found the tool helpful because it just gives you concrete examples of what the behaviors would be. So they've used it in that way. I think there are peer ratings that go on. There's also, we worked with a university in Pakistan, and they were interested in that, doing almost group supervisions with some of the trainees, giving them the tool and getting them to run role plays with each other and rate one another, and seeing that as a learning experience. So I think it can be used in that way. I think the only challenge with that is needing to train people in it and understand it and potentially train people in the platform. Maybe it's easier just to use the printouts if you're doing that. It's certainly possible. We're seeing people doing it. So yeah, there's definitely more innovative ways you could use this.
Okay, I have a related short question to this. So you mentioned that you have TOTs for Equip. Can you tell us a bit more about the duration of those and the structure? Yeah, it's just some general information.
I mean, we're kind of developing our thinking about this. We've done TOTs in the past that have been kind of 3-4 days. We want to condense this down and make it as short as possible. We don't think it needs to be 2 or 3 days, but we're also seeing, so there's different options. For me, a kind of 3-day TOT is if you in an organization are thinking about integration of Equip across a number of different programs, you're thinking it on a broader level. But we've also seen when we've done TOT trainings, for example, in Self-Help Plus, when we're really focusing on the use of Equip, we're selecting only a few items, say from the ENACT tool, we're really structured about how we're integrating it in an intervention. Actually, we can put that in a TOT training and it's very brief. It actually adds only a couple of extra hours. And then with some practice of people assessing competency at the end that they might have done anyway as part of a Self-Help Plus training. So it really depends on, are you thinking about a focused intervention? You're thinking about exactly how your trainers are going to be using Equip, then I think it can be very brief. Or are you wanting to think about this a bit more broadly about multiple applications? WHO this year have done a couple of global TOTs. We're trying to kind of encourage different organizations and individuals to develop their expertise in Equip. And we might continue to do those, but I'm not sure exactly when they would be run, who they'd be targeted at. But we're hoping that we'll build up that group of expertise who can then go on and train others. But as I say as well, if people are interested in this and thinking with us about how they might start using Equip, the help desk is there for exactly that reason. Almost provide consultation, and then we can target training specifically for you or your organization or your project or whatever it might be.
And I just want to share my own insight. So when I get acquainted with the platform, I saw the group ACT version, and I thought like, okay, so for Self-Help Plus, which is a group intervention, we would use a group ACT. And thank you so much, James, for being available to answer all our questions. And you just said that no, group ACT is for much more advanced level of for group therapists rather, and for Self-Help Plus, we would rather use a limited number of specific ENACT measurements. Yeah, and there is probably last question from Alexander Moldavsky. And Alexander, are you able to read your question?
Yeah, is there any data on the impact of Equip on the trainees beyond the? Sorry, were you asking me to read out, or maybe for Alexander?
It's fine, yeah.
Sorry, Alexander, I've stolen your thunder there. Sorry. So is there any data on the impact of Equip on the trainees beyond their competency in delivering the courses, on their mental health itself? How do you assess people with lived experience as trainees in the Equip framework? I don't think at the moment there is, in delivering the courses on the mental, okay. I don't think there is at the moment research on that, to be honest with you. I think that would be something that we'd need to move into. So at the moment, the research is pretty much purely focused on the competency of people trained using the Equip approach. But it's a really interesting and insightful point, I think. In terms of people with lived experience as trainees, actually, so George Washington University are our research partner on the project. They're looking at creating a tool for people with lived experience to assess services. So actually starting to think about how they can become part of the quality control of services itself and how the Equip structure and platform can be used in that way. In Zimbabwe, I keep coming back to this example, we actually trained what we called Equip champions. So we had a number of people with lived experience who were quite active in Zimbabwe, maybe running their own NGOs, but had lived experiences themselves, and they were active in very much managing the platform and the data on the platform and providing feedback to all the trainers on how the trainees were doing. So it was kind of interesting to see how they took on a real role in terms of the quality management of service delivery, but also, you know, kind of like nationwide scale up of an intervention as well. So I think this is quite new in terms of how it's working, and we're hoping to gather more information. But if you have any thoughts and you have any ideas, like, please share them, because I think it's a really interesting use of the platform. And again, but thank you for the point.
Yes, thank you so much. I think this was a very nice and very productive discussion, and very engaged audience, and quite advanced already. It was a real pleasure to hear from you and learn from you, James, but as well from our audience.